Brad, last year ARA started to recognize May as Mental Health Awareness Month. Can you talk to me about your efforts in spearheading that initiative and give me an overview of what work has been done in the space over the last year?
Certainly, as many will remember who may have seen the last year's information, we had one of our most senior managers die by suicide in August of 2023. You guys are going to be hearing from my good friend Tonja Myles today as well, who I met about 5 years ago now, and those years have passed really fast. When we had an employee, a homeless young man we employed to try to help get him off the streets, get him going again, seemed to have plenty of potential. And he certainly did have plenty of potential, but developed mental health condition I just couldn't appreciate or understand. I did not want to not continue to help him. I didn't know where to go with that. And I've developed this great relationship with Tanja, special person. I'm ashamed a little bit to say, or at least honest to say, that in 23, when our senior leader took his life, left behind two children who were not yet teenagers, a beautiful wife, he was highly successful. I had to evaluate myself and say, why haven't I used my resources to help our people here at H&E? And unfortunately or fortunately, after that, we decided to get involved. So to your question, what have we done? We created mental health training that was evaluated by Tonja as well as many other industry experts who helped us compile it. We've made it available to all ARA members and frankly, to the general public, anyone who wants to access that information. I've had many ARE members reach out directly and say, hey, can we get this to run it through our LMS or other types of technology? And our groups have done the work to format it in a way that they could use it for their company, brand it for their company. There is no pride in authorship. We don't need H&E's name on anything. This is about saving lives. That's been the primary thing I would say for this group that we've done. What's been interesting, I had to go back and count, and I thought it was maybe more. It's not. There were 4 people who actually contacted me. ARA members contacted me direct. 2 hit me up on LinkedIn, and 1 just called the office, and 1 emailed. And they all had similar situations. I have an employee who has a problem. Now, those range from severe anxiety and just concern about the employee, with 2 of those employees walking into their supervisor. And after they had had conversations and saying, I've thought about hurting myself before. I've thought about taking my own life. How can you help me? And, we were able to redirect or direct them to resources within their respective communities. These folks were not in Louisiana. They weren't in Texas or Mississippi. They weren't close to our corporate headquarters. Actually, most of them were very far away from Louisiana, where we're headquartered. And I'm proud to say I'm glad they reached out. I didn't follow up. I didn't feel like it was my job to follow up, other than to follow up with those individuals and say, if we can offer any additional resources, please come forward. My hope is that in the last 12 months, people have done just what I encouraged them to do, and that is engage their employees and say, if you're struggling, it's okay. And the proverbial, it's okay not to be okay, and to cause that conversation. As I shared a year ago, this was one of the most daunting tasks. I really had, to the extent I get anxiety, it was a heavy topic for me. But the truth is, whenever I addressed our employees at an annual conference, almost 300 employees total, and subsequently, it was a very easy conversation because people could see that we did care as an organization. And many, many people internally reached out, and many of those people have sought help, and many of them have followed up with myself as well as Tonja in some cases to say, I want to thank you guys. I'm living a healthier, happier life because of you guys making this a normal conversation. So those are the primary things we've done. It would seem like there's something really grand we should have done next or different. The thing we need to keep doing is keep this conversation going. That conversation alone will allow people to seek help because they won't feel isolated. The stigma will not overwhelm them, and they will step forward and say, I'm struggling a little bit.
Yeah, yeah. And in an industry that is, sometimes full of prideful people and hardworking, gritty people, it's very hard for them to do that, I think, sometimes. So that initial conversation can make a huge difference. So, Brad, can you talk about how you did meet Tonja?
Yeah, sure. Well, I said we had hired a young man here in Baton Rouge. He was 22 years of age. Came to work Employees rallied around him. We like helping people. We got a group of employees who really put their back into it, right? Found him an apartment, helped get him some used furniture. He was doing good, teaching him how to manage his checking account, was just doing fine. Worked about 6 months, had some good supervision. People would pick him up and drop him off. He was saving money. And he started to develop some erratic behavior. I was actually out on a finance deal in New York City, and I got a call and said he's on the floor of our CFO's office ripping his clothes off in a fetal position. And I said, well, whoa, get him out of there. I'll deal with it when I get back, right? And so as much as we want to help people, we have to have a safe work environment as well. Long story short, he wouldn't tell me what he was doing. He said he wasn't on drugs, wasn't taking any kind of drugs. I said, well, you can't come to work, back to work until we get you reviewed, until we find the way to help you to ensure that this doesn't happen again. Was very resistant to that. I called local resources. I called our mayor's office. No one would help me. Frankly, I got very aggravated fast. I said, this is ridiculous. This guy can't work at H&E, but he does not deserve to be homeless. He does not deserve to not be helped. Someone at the mayor's office said, you ever heard of Tonja Myles? I said, no, I haven't. They said, well, look, she's a mental health advocate. She's a resource. She's a peer support specialist. She served on a committee for George W. Bush. She was recognized at a State of the Union. And I said, wow, I guess I should watch the news more often. And I text Tonja just before 7 a.m. one morning and said, you don't know me, but I need help. I've got this person and I don't know what to do. She texted me back immediately and said, I'll call you within 5 minutes. 2 minutes later, my phone rings. I'm on the way to my office and I tell her the story and she says, do you know where he's at? I said, I can find him. She said, well, we'll help this guy. And I called my wife up and said, I just met my sister from another mother. This lady said, let's go get this guy. Later that day, I found him. I called her. She said, let's meet. He was completely out of it. And I'm just really kind of interrogating. What are you doing? What kind of drugs are you on? What's happening? Wouldn't say a word. We get out the car. I meet Tonja for the first time. She looks at this young man and says, you look like my nephew. Can I put my hand on your shoulder? He said, yes, ma'am. She said, okay, cut the crap. What have you been doing? And he says, I've been smoking Mojo, which is a synthetic marijuana. I was a little bit insulted that he cracked like in 2 seconds. And here I am, trying to, I don't have any professional skills, right? And that was my first glimpse of the skills Tonja had, aside from her heart and her willingness to go get him and do something about it. We had a couple stories with this young man. Another where I had to get him checked into they wouldn't take him in a mental health facility. He had fevers during COVID protocol. Tonja walked with me to an emergency room where we got him checked in so they could do a mental evaluation and try to get him stabilized. They did, and that helped for a while. Another time where her and I couldn't get him to respond to me, and she texted him at 6 a.m. on a Saturday morning and said, hey, I know you're hungry. You want some food? And he responded again instantly and said, yeah, and here's where I'm at. He was near a mall, basically, at a bus station, a different bus station. I get there. He's got a hatchet banging on a cement block. And I go, hey, lumberjack, let's put that down and, let's get some food. And no problem. He wasn't violent. Tonja gets there 10 minutes later. I tell her what's going on. She's got I wouldn't say fear in her eyes, but a sincere concern, like, what are you doing? Brad, this is a dangerous situation. Long story short, take a long, slow walk with him. She calls the appropriate authorities, not just calling the police, but people who were trained to de-escalate and deal with people with mental health issues. And look, I'll stop with that because the stories go on and on and on. They're not all, but that's how I met Tonja. That's how we have become friends. She makes me do work that I don't want to do. I have always enjoyed working with at-risk and disadvantaged youth. My family adopted a couple of children. I was a CASA volunteer for a number of years. That's more of my space if I have a space. She doesn't mind making me uncomfortable, but the work that her and her group do and the quality that she does it with is really inspiring. And to say that she's also contributed to H&E in such a positive way. She's talked to many of our employees directly. She's made a difference in their lives. And so going on, I guess, our 6-year friendship, I'll tell you what I told my wife that morning, the first time I talked to Tonja. I said, I told Tonja, you don't know me, man, but we're going to be friends. And to this day, that stands true. She is as good a friend as I have in this world. And I don't like the way she pushes me around and makes me do things, but I certainly appreciate the work she does.
Well, Tonja, I can't give you a better introduction than your friend Brad. I mean, you're a renowned mental health advocate, founder, survivor, believer, all these things. Can you talk about the moment that you met Brad and your walk with this young man that you were trying to help?
Yeah, I do. I mean, I get so many phone calls, to be honest. And so each one of them I treat as if it's the most important person in the world, because we all have challenges and we all go through crisis. And so that particular morning when I talked to Brad, what he didn't fail to tell you was, I'm just like, okay, we can go find him. And he's like, I want to go. I'm like, no, I don't think you do. And I had never met Brad then. I'm like thinking, but I can tell he did not sound he sound more suburbial, more than, where I grew up at, I'm just saying. And so I'm like, no, we're good, sir. You stay where you are. We got this. He's like, no, I want to roll out. I want to go. And I'm like, no, you don't, sir. You're nice, but you don't want to go. And anyway, and so he wanted to go. So he was very adamant, as he always is. And I'm like, okay, well, let's roll. And so it was just like, passion at first sight. I remember one time as well, we were going to, try to find him again, or Brad went to, you know, help him out. And I'm like, Brad, where you going? He told me, I'm like, ping me. I need to see where you are, and I'm like, you gotta ping me. I said, keep your phone so I can hear, because I was really concerned about, his safety. And, but he is no stranger to crisis. He's no stranger to serving people. And so it's just been a good, passion, a good friendship. And I'm just grateful what he has done with H&E. I mean, I've never seen anything like it, before my career, with such passion and such can do, and like, let's get it done. I mean, from thought to conception, he had it worked out. And even some of the other things that he's done, even by getting someone, one of the things I really like is when he was talking to his employees. That means because he's engaging, he's always listening. And they were just saying, hey, we have some challenges, maybe, getting in network and seeing a doctor and stuff like that. And he's like, wait, what? And then he was called that provider and like, look, we got to get this change. And so many other, things that a lot of organizations has not done, that, H&E and Brad, they're taking, their leadership, and they're really leading by example. And look, at the end of the day, I know we all want to talk about the productivity on, on our jobs and in our organizations and businesses, and we talk about the bottom line. But I believe when, we really make sure that people are heard, that, they are made aware, and their surroundings are conducive, to work, the productivity, even goes up, which makes the bottom line even better. Even though this is not about bottom line, it's about people. And so what H&E has done is really pretty phenomenal. And then the fact that they want to share it with so many other people, that's rare. And so I know it's going to make a difference throughout the country. It already has. And it's just been a joy, to just on this journey. I tell people, I love my job, but I hate what I do.
That's a strong phrase. So Tanja, let's talk about your work. You are in DC right now to do another briefing on Capitol Hill in conjunction with the Huntsman Family Foundation, I believe. Can you talk about the work that your foundation and your work has been doing in the mental health space?
You know what? I have a promise to keep. I made a vow to God, over 35 years ago. If He would help get me out the dark hole that I was in, and He would give me my dignity and my self respect back, that I would work every day, to do His will and to help people who are struggling with addiction. And that's a promise that I intend to keep all the days of my life. And this is not just something that's a job for me, it's a calling. I've been, like I said, been in recovery for a while, a long time actually. Had childhood trauma that led to a lot of my substance use disorder, a lot of my mental health. 3 times suicide attempt survivor. Been in a mental hospital 3 times, and I basically live well with having a mental health diagnosis. I am a veteran. I have PTSD. It doesn't come from being in the military, but it just comes from a lot of untreated trauma. I had hopes and dreams to sing on Broadway and entertain people because I love to do that. And, I said that, she died and nobody grieved for her, because nobody knew. People used to always say, Tanja, oh my God, you have changed. You're such a goofball. I'm being nice. And I went from being this happy-go-lucky kid to just someone who's already always angry. And nobody ever asked me, Tanja, what is wrong with you? They always said, Tanja, what the hell is wrong with you? They didn't say what happened to you. And look, my parents, I love them so much. They did the best they could without knowing what resources were available. And then back in the day, being, a family of faith and just my culture, you just didn't talk about those kind of things. You prayed about it, you put it on the blood, you keep it in the house, and you keep moving. And so, my life got worse and I started doing drugs and doing the minimum amount. Before you know it, I was a straight up crackhead. And so just made a lot of bad decisions. And but by the grace of God, I'm alive today because most people didn't think I lived to be past 18. So I do this work because of that, because I have a promise to keep. And so I wake up every day to push hope. I cannot do this work by myself. We have an incredible team of people that work with us. And so, my husband and I, we opened up the first licensed faith-based treatment center in the state of Louisiana, first of its kind in the nation. We sold it in 2010, I believe, yeah, and then it's still going strong, under a new name. So this is not just a, work for me. It's my calling. I know how it is when you're in the depths of despair, where you feel there's no hope. I've been there when you're thinking that you're not good enough, you're not worth it, that, you're just the scum of the earth. I'm not I'm not new to this. I'm true to it. And so when I can always connect with like-minded people like Brad, there's strength in numbers, and it's just been a win-win, combination and collaboration.
Wow. What a powerful story. So what are you going to share on Thursday um, with the folks on Capitol Hill?
So you know what? I am so grateful because working with the Bush administration prepared me for a lot of where we're having a briefing on Capitol Hill. This whole month is Mental Health Awareness Month, and the 15th is Mental Health Action Day. And so we're going to be doing a briefing on Capitol Hill, talking about what's working across the country. Like in Louisiana, we have some of the best drug overdose death decreases in the country, and a lot of that has to do with H&E and partnering together. We call it public safety, public help, and public health and public hope. Because when you get those three things working together, you see the outcomes that we had. I think that every city should be able to do that. When you bring businesses and faith-based organizations and philanthropy and community together, you get what we're doing, and we want to share that. And so we get to talk about that because we know that the fentanyl crisis is no joke in our community. We know that mental health is also a crisis. And so we're bringing national experts from all across the country to talk and share the information. We know there's some uncertainty, when it comes to a lot of things these days, but bringing everybody together to talk about what they're doing and how they can share that information across the country. We're doing that. And we're going to address the fentanyl crisis with some experts. And then we're going to also address some mental health and suicide prevention with some of the leaders in the country. And then in the room will be all these incredible people from all different organizations with lived experience like me, and family members, and politicians, and all these other folks coming together. And so the briefing and the reception is going to be incredible. And then the new deputy over SAMHSA, Dr. Art Kleinsmith, he's going to be doing open remarks, which is pretty cool because this is kind of like the first time this has ever been done under the new administration. And it's the first time, even though last year we did it to address mental health, but it's the first time that we've had a briefing like this to talk about the fentanyl crisis. And I'm just grateful that, I get to host this and put this together, set free, along with the help of Senator Cassidy, who's the host, who got us, all the good space and stuff like that. So I'm just really grateful.
Gotcha. Share what the overdose percent decline was year over year in East Baton Rouge Parish?
32%. And so since we've been doing the work, Peers on Point, and what that is that God gave me this idea and told me to write this curriculum that where law enforcement would be paired with peer support specialists like me. And then every time there's a POD, a possible overdose, they go out. And so that's one of the things that they do. And so if that person is alive, then we talk to them about getting them in treatment, share our lived experience, and we'll Uber them and take them to the Bridge Center or any place. And if they are, non-fatal when we get there, then we're able to to do support. And so, they also go out from 6, you know, they're on call from 6 a.m. to 12 o'clock midnight. And then when they're not on call, they're canvassing churches, businesses, neighborhoods, because I'm a military girl, so we get the data from the DA's office. And when I get that data, and there's a team lead we have, she's ex law enforcement, and she has a mental health background. Well, she'll get that, and that's how we go out to those places where we see drug overdose happening the most. And so, since we've been doing the work, because it took me 2 years to even implement it, because when you're working with law enforcement, you have to be trained, you have to know a crime scene, you have to go, they have to change their systems and all of that stuff. But the end results 2 years later, and since we've been doing the work, there's been a steadily decrease in drug overdose deaths. And look, we're excited, but we're not satisfied.
Yeah, that's so crucial, right? Because law enforcement shows up and they have one set of skills that is not the set of skills that you have, Tonja. Like
Right.
Brad was saying, I'm trying to help this person and I'm just in investigating, interrogating, and that is not, in these certain
Mhm.
situations, there's a different need, a different skill set that law enforcement don't naturally have. They're not trained to
Right.
do. And
Yeah,
so
but let
that
me.
partnership is so cool. It's so crucial.
Yeah, it is. But the other thing too is that I get to do CIT training where I help train law enforcement on how to de-escalate. Because a lot of times when they see someone in a crisis like that, they think, well, that's just another person. I'm like, that could have been me. That was me. You know, um, the last time I went in the hospital for suicide ideations, when it wasn't suicide, it was full-blown attempt. It was the police that my family called, and it was an interesting time because one law enforcement officer, he recognized who I was. He's like, "Didn't you train me?" I'm like, "Yeah." And he knew his job because he had been trained how to de-escalate. The other one treated me like I was a criminal, and so I was almost about to home in on him and do suicide by cop. And then my nephew was standing to my left, and I'm like, I cannot let this be the last scene that my nephew see me as doing. And of course, I tried to talk my way out of it. I'm like, oh, I know everybody. I know the sheriff. I'm getting out of this one. And they were like, no, too many people are looking for you. You have to go to the hospital. So, yeah, I mean, again, this work is heavy, but it's worth it. From the curbside to the country club, so many people are suffering. And so we need to make sure that we get the resources out. One of the things that, Brad and H&E did was is that he went to one of the local media companies and for and spend a lot of money, getting to because they deal with every demographic from urban to moms to business people, and for a year had some of the best outreach when it came to addressing fentanyl. And so again, public, safety, public health, public hope. When you put those three things together, we get the outcomes that we're getting, and we want to share them. And that's why we're having this briefing. And I'm so excited, and it's going to be great.
Yeah,
One
I'm
thing, one
excited to see.
one thing we haven't mentioned, and we may have time to mention it, but just in case we don't, 988. We talked about it last year. It's also been marketed. It needs to be talked about. If you or someone is in crisis, just the way you would call 911 if there were an emergency that regarded that needed it, you call 988. And Tanja likewise can share more information. But 988 is a number that anyone who may see this clip needs to remember, needs to have it available, and needs to share with others if they are unaware, because it's a tremendous resource for an individual who's in crisis.
Yeah, it really is. And, thank you for that, Brad. You're absolutely right. Look, a lot of people don't know about 988, and we're changing that because it's only been in existence going on 3 years. Matter of fact, I testified on Capitol Hill, and shared my story right before it became a law, and work with the 988 folks to help get the word out and stuff like that. And it's been incredible because you can call that number 24 hours, 7 days a week. You can call, chat, or text, and there's a licensed, compassionate person to answer you. It's not just for if you are, thinking about, death by suicide, but it's also if you're in an emotional crisis. It's also if you're in a substance use disorder crisis. And it's not just for that person. A lot of times family members, they don't know what to do. And so they need a spot or a place or a number that they can call and say, look, what can I do to help my loved one? And so I call it a call for help with connections to hope. And so we're seeing some good outcomes. Millions and millions of people are calling it. And at the end of the day, it's not going away. It's something that's going to be around, forever, just like 911. And so I'm just excited about that and the work that's being done to just really meet people where they are and get them the hope and help that they need.
Yes, amen. So Tanja and Brad, what can business owners do that are watching this to start? I mean, it's such a heavy topic. And I know a lot of times people feel unequipped or unqualified to begin these conversations with their businesses. What is your advice? How do they start?
I'll go first. Talk to your employees. I mean, if you sincerely care about your people, and you say we're a team or we're a family or we're the best organization that does what we do, well, then family looks out for one another. We have almost 3,000 employees at H&E. I don't know everyone. I can't know everyone. There was a time when I joined the company 27 years ago and I knew everyone, or they knew me because I was a new guy and we had 9 locations. There are a lot of ARE members with 1, 2, 3, 4 locations. I believe those are families. If you would take the time to go meet with an Ahmed clinic in case someone gets hurt later, then you should take time and talk to your employees and look at them in the eyes and say, "How are you doing?" And I tell people, don't be weird about it, right? I mean, don't stare them down. They're going, "What the hell's wrong with this guy? Maybe he needs mental health help, right?" But if your employees don't know you care about them, don't expect them to come engage you. If you don't know about the mental health resources in your community, I didn't know what the Bridge Center for Hope was when I met Tonja. I didn't know you could take an individual to an emergency room and have them admitted at a normal physical medical emergency room for mental health. I didn't know that. Maybe I should. Again, I don't mind sharing all that. I learn things every year, right? But don't wait until you have a crisis. And you may think, well, I don't have, their companies have 20,000 employees, right? H&E is not the biggest company at what we do. But there are people I'm worried that may have 15 employees or 30 employees or 50 employees. I think statistically, it's not going to happen to me. You are better suited than anyone else to let your employees know you care. You're better off to have those conversations. And it's very easy to research what is available within your community, and don't wait. That would be my advice for anyone who would want to hear it.
And I would, piggyback on what Brad said. At the end of the day, one of my mentors, Dr. Frank Campbell, he's one of the leading top suicidologists in the country. And I never, forget when I asked him, like, so what's the most simplest thing that you can do? He said, Tanja, ask a person, what does it hurt and how can I help? And just meet people where they are. And like Brad said, don't be weird about it. Just say, hey, look, I care about you. Is there something I can do? And then if that person say, well, yeah, I'm going through this, and you might go, okay, that's kind of a bit much. And not say that's a bit much. And just tell them, look, let me see if I can help you get some help. And that's when you go to 988, because you can call someone and say, hey, look, my coworker is experiencing this. I don't know what to do. What should I tell them to do? And then that's another thing why, the whole presentation and the video and the awareness that H&E has done is so helpful, because it helps people go through the steps of, if they encounter different things, on how to do it, how to address it. And look, it's just a tool to have in your toolkit. Like I said before, addiction or mental health does not discriminate from the curbside to the country club. It happens to all of us. And so making sure people know the awareness, education, and then let people know that you're not the only one. The CDC says 1 in every 4 Americans will have a mental health experience. It could be depression because of loss of a loved one, a breakup of a teenager who's, breaking up with their first time boyfriend. It could be so many other things. And so having that number to call and reaching out, and look, like we're talking about it now, that's how we address stigma. That's how we make it normal. Because look, if you ask me, Tanja, oh my God, your glasses look good, which they do. And I'm like, yeah, they do. And oh, what eye doctor you go to? And I would tell them the eye doctor. And so if somebody would ask me, you go to a therapist, who you go to? And I'll tell them. And I'm like, oh, and I go to a psychiatrist too. You want his name? He's good. So, things like that. Just make it normal. Like, it's okay.
Let me add one thing too. This is not, I mean, Todd just says, curbside to the country club. That's certainly true, right? It's not about how much money someone has or where they hang out that's going to decide if they have a substance abuse or mental health issue. Let me also add, if you live in a rural community or you're serving more rural communities, just thinking about all of the ARA members who are out there who aren't in the middle of a, million plus population. And you
Yeah.
think, no, I've got cowboys and farmers. Let me tell you, it's just as real for those folks. Do not fool yourself and think that those folks are different because they live maybe a better quality or a slower pace of lifestyle, or they're grittier or tougher, whatever you tell yourself. It's just not true. I've
Yeah.
seen it firsthand. The grittiest, quietest, easygoing people suffer in silence the same way as the fast paced go get 'em people do. So don't excuse it one bit if you think I'm out here in the country in the middle of a different city, or we don't have those problems. Mental health issues exist, and
Yeah.
just please do not fool yourself and believe they don't.
Yeah. Yeah. I mean, the fentanyl crisis, where I grew up in rural Illinois, it's like it's a huge deal out because we can't get a lot of the resources, right? And people
Yeah.
just it's just a big problem everywhere. So, Tanja, I do want to talk to you about this, though. Um, uh, in the remarks of the Bush administration, when they were speaking about you and your work, they talked about the effectiveness of your faith-based mental health advocacy and how having that aspect of it makes all the difference. What does that mean to you that, that Jesus are at the center of your work?
Because, but by the grace of God, there go I. And again, it was my grandmother who had been praying for me for years. And, we call her Medea. She's the real Medea. And I know one of the main reasons why I'm alive because of her prayers. When there were places that I OD'd and should have died, and places where a gun was put to my head, and, or when the rape was so brutal, things like that. And so it was my faith that kept me. It was my faith, that covered me. And so, again, I made a vow to God. And so the interesting thing was is that once I got saved, I did go to the church, and the church was like, "We don't know what to do with you." And I'm like, "Hmm." And then I started doing research on what was out there, in our community across the country. And I'm like, "Oh, there's nothing. I'm gonna create something." And I remember being told, when I did, create a model, and I went to LDH, and they told me, I quote, "Hell no, that's never gonna happen. You're never gonna have treatment and faith, and it's nothing that we're gonna ever pay for." And of course, 3 years later, they had to bite that because that's what President Bush wanted. He wanted, he knew that programs that had a strong faith component had great outcomes, even better. And so when he wanted Congress to give more money and to make sure that faith-based organizations, who were licensed and who had all the credentials, were at the table, that they should be able to get funding as well. And so it was pretty cool. I mean, to be a part of history, and just to be at the State of the Union address. And so they're, how they vetted me was pretty incredible. And they just found me. And so I'm grateful because there's so many other organizations that do good work. So I cannot thank them enough. Even now, I mean, all of that has propelled me to where I am today, even sitting right here, getting ready for the briefing. And so my faith is everything. And I believe that, what John 8:36, says, whom the Son sets free is free indeed. And, my life is not my own. I was bought with a price. And so I'm just grateful that I get to share my faith, and people know it's front and center. And it's what I wake up every day to do on a mission. And so God is good. His grace is sufficient. And I know there's so many people out there who are hurting, and they need to know that they're not the only one, that God has a plan and purpose for their life. And addiction will still kill and destroy that. But there's grace and there's mercy, and that, people can live a good life. And I have to tell people that because I know how it is to be in that dark hole that you think that you're never getting out. But thank God for his light, for his grace. And, you know, it's amazing. It is. And I'm so grateful to him for favor and everything. So I love it. I mean, my faith is everything. And I lead with faith. I ended with faith, and all in between is like a lot of, knucklehead stuff. But I also think I'm funny. Brad and Darren don't think I'm funny. That's my husband. But the Bible says a merry heart does good like a medicine. And so anything I could do to, you know, give people the hope that they need, that's what I want to do every day.
Let me add, Tanja, that's awesome. And I know how much faith you got. You know how much faith I have for that matter. We've also come across people that Tanja and I both know who have believed that faith alone and praying was that all that was needed. And I think that's important. Let me add, and Tanja would say the same thing. God wants us to use these brains he gave us as well. And, if something's wrong with your knee and you need a knee replacement, it's good that you pray for a speedy recovery, but you go to a knee doctor.
Mm.
And I don't want anyone to miss that as well. That faith piece, consider that, a lot of extra help towards achieving the goal. And
Mhm.
God is real and he can provide anything he wants, but we don't need to test him. And we need to make sure that we go seek the help that he's made available to us.
Yep, you're
Yeah.
right, Brad. And look, I take a script and a scripture every morning, and you can have Jesus and a therapist. I'm just saying, And so, yeah, you're absolutely right. And look, that's another thing I'll say real quick. The church that I'm so much a part of, the faith-based culture, we have done a really challenging job in addressing that. We want to tell people that's of the devil. They're full of the devil. I know the difference between oppression and depression. And so, if somebody had cancer, we wouldn't treat them, that way. And so, yeah, but we've come a long way. And so I'm just grateful that, we're still on this journey, and I can't thank Brad and H&E enough for taking on this mission, because of stigma, people don't want to talk about it. But the fact that they did not just step up, they implemented new and creative things, for their company. And I believe that's one of the reasons why they're so blessed. And then, Brad, I'm like, oh, Brad, we could do this and we can do this. And oh man, we could just do this. He's like, girl, go sit down. This is what we're doing, and we giving it out for free. I'm like, okay.
Yeah, we're not selling anything that can save lives. We want to donate anything we can that'll make a difference.
That's right.